Acute renal failure. So let's first get the basic of acute renal failure. Here are your kidney, and one of the main function of the kidney is to filter the blood and remove the nitrogenous waste, excess of the fluid and excess of the electrolyte from the blood. The sudden impairment in the functioning of the kidney, and that's too when happens in a short period of time, it leads to increase in the concentration of this substance, and there can be a lot of problems that can arise due to excess of the nitrogenous waste in the body, various types of electrolyte imbalance in the body, and also fluid overload. So let us understand in brief the consequence of acute impairment of normal kidney function. First, coming to the nitrogenous waste. The nitrogenous waste of the body get raised, which is represented by increased concentration of blood urea nitrogen as well as increased serum creatinine values. Various types of electrolyte imbalance can occur in acute renal failure, like the serum sodium concentration get decreased, serum potassium get raised, serum calcium get decreased, the serum phosphate concentration is raised. When serum pH get decreased, that is the blood become more acidic. One simple trick to remember all of these electrolyte imbalance is to remember two set of iron, the sodium, potassium, calcium and the phosphate, and to remember that the normal serum sodium is higher as compared to potassium, whereas the normal serum calcium concentration is higher as compared to phosphate, and the errors just get reversed in case of acute renal failure. One important problem in ARF is the fluid imbalance. Since kidneys are not functioning properly, the body can have hypervolemia, that is excess of body water, or hypovolemia, that is deficit body water. Hypervolemia mainly occurs in oliguric and anuric ARF, when the kidney do not produce enough urine and the water gets retained in the body, and hypovolemia occurs in advanced ARF when the kidney lose their property of concentration. Let us understand how we define acute renal failure. And to define acute renal failure, it is important to remember the normal value of some renal function tests, like normal serum creatinine concentration, which is 0.8 to 1.3 mg per deciliter, and normal urine output, which is 1 to 3 milliliter per kilogram per hour. When the serum creatinine concentration rises more than 3 mg in 48 hours, or it is rise more than 1.5 times normal value in less than 7 days, the patient is said to be in acute renal failure. It can also be defined on basis of urine output. When urine output falls less than 0.5 milliliter per kilogram per hour, the kidney are said to be in a state of acute renal failure. Now, let us understand the types and etiology of acute renal failure. So this is a brief overview of our urinary system. The blood is filtered to the kidney. The kidney produces urine which passes through the ureter into the bladder. Urine is then voided out through the urethra. Another important structure lies here. Here it is the prostate. So there are three types of acute renal failure. The first is the pre-renal ARF, second is the renal ARF, and third is post-renal ARF. Coming to the original type of ARF, it mainly occurs due to inadequate blood perfusion to the kidney. Kidney is mainly supplied by the renal artery and is situation like hypovolemia. When there is total body water deficit, the body is unable to maintain its proper blood pressure to maintain a normal perfusion of kidney. This situation mainly arises in cases of excessive blood loss, diarrhea, and vomiting, burns in which there is fluid loss to the damaged skin, and also pancreatitis in which there is third space loss. Pre-renal are also occurs due to the reduced cardiac output from the heart, which lead to decreased blood pressure and inadequate perfusion of the kidney. Mainly occurs in case of heart failure and also septic shock. Third important reason of pre-renal ARF is the disease of the renal vessels, such as the renal artery stenosis, when the lumen of the renal artery gets blocked. The renal type of ARF occurs due to disease which are primarily localized in the kidney. Most of you may know that the kidney are mainly made of the three types of structure. The first important of them is the glomeruli, and the disease affecting glomeruli are called glomerular nephritis. Second important type of structure in the kidney are the vessel, and the various type of vasculitis affect the vessel and damage them. And the third important structure of the kidney are the interstitium, and the disease like acute tubular necrosis affect the interstitium. The post-renal type of ARF occurs due to mechanical obstruction in the flow of urine, and this mainly occurs due to urinary stone, which block the urinary pathway, or also prostatic enlargement in case of benign prostatic hyperplasia.
Hello, my name is Dr. Mira. What is your name?
Mira Safia,
Okay, how old are you?
45 years old,
45. Where do you live?
Percutaneous,
What is your nationality?
Malaysian.
What is your job?
I am a driver.
Okay, are you married?
Yes.
What is your complaint? What brings you here?
I have a pain, severe cramp at my left flank.
Left flank. Can you tell me how did this pain started?
The pain started 2 hours ago with no reason. Then I called the ambulance and they took me to the hospital.
Okay, do you have any fever?
No.
Do you have any past health history?
Yes, I do. I have gastric ulcer.
Any allergy?
No.
Do you have any blood transfusion before?
No.
Are you smoking?
No.
Do you take any alcohol or drugs?
No.
Any family health history of disease?
No.
Do you have diabetes mellitus?
No.
Any operations before?
No.
Do you have tuberculosis?
No.
Stroke?
No.
Myocardial infarction?
No.
Any major health problems?
No.
Do you take any medications?
No.
From the collected information at this moment, we can conclude that the patient might have problem with the kidney based on the location of the pain at the left flank. To find out the actual problems indicates on the genitourinary system, the additional complaint should be obtained from the patient.
Do you feel pain at here above your pubic part?
No.
Do you have unusual urine color, might be red or other colors?
Yes, I have a red color of urine.
Do you have feel any pain when you urinate?
Yes, for several hours.
Okay. Do you feel any pain during urination, such as burning?
Yes.
Do you have pain in your lower back?
Yes. Do you feel like you are completely urinate or not?
Yes, I feel my urination is complete.
Okay. How many times per day do you urinate in a small amount?
About 9 times.
Okay. Any abnormal appearance of your urine, might be dark, concentrated, or cloudy?
Mine is cloudy.
Okay. Any unusual substance on your urine, such as blood, pus, particles, or sediment?
Sometimes present sediment like particles.
Does your urine have any smells?
Yes.
Do you have history of kidney disease, like pyelonephritis, glomerulonephritis, or renal stones?
No.
Do you have any X-ray examinations of your vascular system before?
No.
Do you have any trauma, crash syndrome?
No.
As far as I understood, you don't take any medication.
Yes.
Okay.
From additional complaints, we can agree that the patient have problem with kidney. She has complained about the pain at the lower back, burning during urination, together with the excretion of small amount of smelly, cloudy and red color of urine with the presence of sediment-like particles.
Do you feel thirsty?
No.
Did you experience weight loss?
No.
Can you tell me what is your weight?
70.
Okay, can I take your hand? Okay, so I want to check does your skin is dry or not. So you are having normal skin, and for the skin figure, you have a normal skin figure. Can you show me your tongue? Okay, so it is wet. It is normal. You also do not have any sign of drowsiness and confusion, as you are responding well to my questions. Can you please show me your ankle?
Yes.
Do you have any sudden inability to control when you want to urinate?
No.
From the obtained information that we get, the patient shows no signs of dehydration and no signs of edema. We can conclude that the normal consumption of fluid needed to the patient is 2,450 ml, as 1 kg fluid needed is 35 ml. Next, we are going to do the objective examination on genitourinary system to make further investigation on the patient. During inspection, we found that the patient has no swelling, no tenderness, no hyperemia, no edema, no scars or lesions, no ulcers, no inguinal hernia, and absence of discharge.
Okay, Sophia, I'm going to do percussion for both of your kidney side. So if you feel any pain, please tell me.
Okay.
Do you feel any pain?
No.
Do you feel any pain?
Yes.
From the objective examinations, we can conclude that the patient will have pain at the left flank. This indicates the acute renal failure. To be confirmed, we are going to do the laboratory test, which consists of lab tests of urine test called urinalysis and blood tests for check the creatinine and blood urea level. For instrumental diagnosis, we are going to order ultrasound, X-ray and CT scan. We will ask the patient to urinate first in the urine sample container and withdraw a small amount of blood to be sent to the laboratory. From the lab result, we can see that the patient has low level of urine output hourly and daily. There's also the high level both blood urea and serum creatinine. In a conclusion, the patient have renal dysfunction. The form of renal failure is post-renal failure, as the patient has the presence of stones together with the lab test that shows the indicator for having the post-renal failure. For the management, the patient will be inserted with the Foley catheters at 10:30 a.m. to start observation on the urine output. At 10:30, we obtain the urine color is cloudy, the concentration is high, there is no presence of stones, and the urine color is red because there is a presence of blood. The Foley catheter is given to the patient as the patient has pain when urination, so using the Foley catheter might reduce the pain. From the chart, the collected urine volume is 760 ml for first 24 hours. This shows that the patient have oliguria, as the patient does not excrete 1,680 ml, which is supposed to be excreted for the first 24 hours. The reason why is because the left kidney has been blocked by stones on the ureter. This is why that the urine cannot pass to the bladder, which causes the decreased amount of urine being excreted, and also the increasing of the creatinine level. The red urine in color explains the presence of stones that damage the wall of ureter, which caused the patient to have a hematuria. For the treatment, the patient has received 1,450 ml of fluids by mouth and 1,000 ml by intravenously. The total volume that the patient received is 2,450 ml. The urine that being excreted is only 760 ml. The other volume is being excreted by the other way, which is respirations, perspirations, and sweating. The observation of the urine is continued at 11 a.m. until complete the 24th hour and being monitored for each hour. Each hour, we found that the patient has the transparent color of urine with the normal level of concentration. There is no presence of stone and there is no blood in the urine. The patient still being administered with Foley catheter for the first 24 hours until further treatment is given.
There are two types management of patient with post-renal form of acute renal failure. First, decompression of obstructed area using Foley catheter or suprapubic catheter. And the second one is urethral obstruction may be corrected with percutaneous nephrostomy tube.
A nephrostomy tube is a catheter placed in your kidney that connects to a drainage bag to collect urine outside of your body. The nephrostomy tube is usually removed prior to hospital discharge. Sometimes patients go home with the nephrostomy tube, and it is removed several days later during a follow-up appointment.
Other than that, we can also provide nutritional therapy. First, provide protein diet. Then, calorie requirements are met with high carbohydrate meal. Food and fluid containing potassium or phosphorus are restricted. Patient may be require parenteral nutrition.